Hi, my name is Elena Blinova. I'm master and trainer in permanent makeup. I'm also a multiple winner in a few different international competitions for velvet eyeliner. And today I'm going to share with you my signature technique and I explain to you how you can do successful procedure and potentially win in championship. For mapping, I'm going to be using black brow pencil, just a regular brown cosmetic pencil for shading, and the brush. So here is our beautiful model with beautiful eyes, and we're gonna do soft shaded eyeliner for her. So first of all, we're asking the client to look straight in front of themselves and obviously blink. Obviously, you have to tell them so they not focus, otherwise they're gonna start to tear. How we're gonna find direction of our eyeliner? We're gonna be basing our tail on all ascending lines, which is a jawline and eyebrows bone over here. So that line should be in parallel to those ascending lines. Always keep your hand on the client's face for stability, and without putting too much pressure, we're gonna do the line. Close. And now I'm gonna connect. So now I'm doing this approximately so I can see if I like it or if my client like it. I'm connecting my tail to the lash line, lift the lashes a little bit and fill it up gently without putting again too much pressure. Fill it up with color. And then immediately using a brush, before the pencil dry out, we stretch gently our shade. Open, crackle. Close. You can use the same brush to clean up a little bit, to thin out the lines. Try to make the sketch as clean as possible because your client not necessarily understand how it will look healed. So we have to create our sketch less or more close to how it will heal, to a healed result. Open. Okay. So we're gonna use Q-tip to blend a little bit more. We have a very young model here, so sometimes their eyelids could be a little bit oily and I find that the brush might smear it a little bit too much. So in that case I use Q-tips. Okay. Okay. And that's it. From this point, we're gonna show the client a sketch, and if she will approve it, then we're gonna do a second eye. Never start the other eye without confirming with the client if they like it. Otherwise, you're gonna do double work. Okay. It's not gonna be that long. Чуть будет покороче. Right now we're gonna find direction for the other eye. I turn my model towards the camera, so I might be not so accurate right now. I'm gonna fix it, turning her face towards myself after. But we're finding also direction. Верничка? Yeah, I did a little bit too low. Let me just close it with my hand for a second. It's very important to do it as your client sitting. Close your eyes, because everyone is different, and when we lie down, everything might look straight and symmetric. Once we get up, gravity will change how it looks. So always check seating. Even if you prefer to do the mapping line down, always check seating. Once again, very minimal pressure for two reasons. Why we don't want too much pencil? Two, we don't want to irritate the eye for no reason before we even start the procedure. A lot of the times I do for the second eye, because client already approve everything, a lot of the time I only do the tail, because this is what I need for my first pass before I apply anesthetic. Open, turn towards me. So here's our sketch. Закройка, close. Always check when with eyes closed and open. So what I did, this eye position in her eyebrow bone a little bit higher than this one. So that's why this eye will be always looking heavier. So I had to go with the tail slightly lower in this eye than this one in order for them to look symmetric when she's looking straight. Always pay attention to that, because it will be very hard to fix tails after. Close again. Okay, open. So for this procedure I will be using Zion S, and I use 3.2 eccentric. Needles would be FIT, it's 25 diameter long taper point. And my favorite Etalon Mix eyeliner set from Anna Vasilieva is gonna be number 1, which is black, and number 2 is a dark brown. So before we start, always pay attention how you place your hands. The left hand, always you put the palm on the forehead for stability. And now we're gonna place the thumb and the index to stretch the outline exactly with the direction the way you draw it, and press a little bit on the bone over here. The client will feel way more comfortable. Place with the right hand, placing your wrist for stability on the pinky, and strictly with 90 degrees we're gonna outline. Keep in mind that our client doesn't have anesthetic yet, so we're gonna, with the scratchy motion. 1 second. Check in the middle. And I'm using dark brown for the outline. I always do that because eyeliner lasts for very long, and we don't want black to stay on the tail forever in case of any skin changes. And as I'm approaching to the tail, I'm reducing pressure and leave the hand out. A sec. We're gonna check in the middle over here before you wipe it all. Yeah, that's it. As you can see, the line is super thin, super crisp, and it's there. So what I'm gonna do, I will apply secondary numbing right on that line before I apply overall numbing, because secondary numbing will help the color to appear even more. And we'll do the second eye. Same thing with the other eye. First we place in left hand, and we stretch the outline with direction of the tail. Strictly 90 degrees with scratching, but feel vibration. Don't be scared, and you have to feel vibration. Otherwise, once you wipe, nothing will stay. I know it's a little bit sensitive. My client is a little bit jumping, but it's only a few seconds. I always do it without anesthetic because we don't have any swelling. And that makes our tail accurate. I would add a little bit more. a little bit more, but I always prefer to have it super thin and light. I can always add once anesthetic is done. Can you see? Did it drop the line? Okay, so right now I'm gonna clean my pencil, wipe everything, make it clean, and we will apply primary numbing on the lash line for 15 minutes. Okay, I'm using applicator. I already put a little bit Dr. Numb on it. I'm inverting eyelid and gently applying anesthetic on the lash line. This is the most sensitive area. Once your lash line is fully numb, your client will feel pretty comfortable. And then afterwards you can smear it a little bit. Don't apply too much primary numbing on eyelid over here to avoid unnecessary swelling. Always tell your client that at the beginning it might burn, it might tinglish. This is completely normal. This is nerve receptors reacting to the anesthetic, as long as the burning sensation doesn't increase. In that case, you have to wash the eye and apply anesthetic all over again. Okay, the numbing time is done. I already wiped the numbing gently, making sure that it doesn't burn my client. So I'm holding the eye sometimes to prepare. I'm preparing the cotton in case if she's gonna start tear. Stretching again the direction of the eyeliner, and we're gonna start with a very tiny movements. It's almost like you're scratching the skin without exact direction. You can go this way, you can go this way, as long as your motions are very tiny. But obviously make sure that you feel vibration. Start a little bit, wipe and see if your pressure is okay. Keep in mind, we're using brown pigment. You're not gonna see a lot of color right away, which is a good thing, because you're gonna have options to create gradient or correct it a little bit, versus if you would be working, wiping, and then you see a lot of pigment right away. So I'm staying in this corner. Pigment usually doesn't really go so easy in that corner. So we have to just make sure that we implant it enough before I go more up. Alright. Color already slowly appear. It probably won't show so much on the camera, but I can see it. I'm not moving forward until I see at least 80-90% of the color. I'm trying to finish the eye with maximum 2 passes. Once I feel that my first layer is filled good enough, now from that point I can go higher in my next layer and spread a little bit my strokes, make it more looking airy. So this way you're creating a gradient. We never do shading at the end of the tail. You always have to leave half a cent, like I would say 0.4 or half a centimeters without shading. One part will be not even healed, and whatever will heal, you need to have a little bit of empty space on the tail so it will look crisp. Now wipe again. And keep going. If you see a little bit of peak point bleeding, it might be that the needle is a little bit too sharp or opposite for that particular skin. I always prepare 2 or 3 needles. In my online and my offline classes, I always teach how to choose needles by different parameters. So we're going to be going like this, block by block, until we see a little bit more color. Okay, as you can see, I did already a couple blocks. Always open up a little bit. I'm not really working on the lash line yet. It's going to be for my second pass. As I'm moving forward, I always keep my fingers pretty tight and flat. So this way you can stretch better. Because if the skin is more bumpy, you're not going to implant the pigment very well and even. Once again, working on the tip of the needle with minimal pressure, yet feel for vibration. When we vibe, try not to really pull the eyelids and skin. Just do it with tiny bit pressure. And I always check what I see. I close the other eye open. I always check the client open with open eye, and I see how much more of a shading I should go. Always have to be like a rounder shape for shading. Okay, close. We have closed eyelids, so we're not doing 3 layers of shading, it's only 2. Otherwise it will make the eyes looks heavy. I can always, you can see, when I'm going for my next block, without leaving the skin, I'm actually going back and forward and completing my blending. Cleaning towards the nose, making sure there is nothing stays on the lashes or on the skin, just dry. Otherwise, I saw that happening when you feel like you've done it, and then the pigment just dry on the skin, and once you wipe it, nothing is there. So after my first pass, I apply secondary numbing for 3-5 minutes. And now I switch the needle for even thinner needle, 0.20 diameter. This is needle hollow. And I'm going between lash line. I'm trying to make it super powdery, super airy. And I blend my lash line into my main color. I'm using black color right now. Working on lash line, never create a solid line, because once it heals, it looks cheap. It looks like old school permanent makeup. We want it to be one, not turning into any unwanted color. And when you apply black powdery, it will actually look black. I'm gonna wipe right now and see before I continue. I'm not extending my lash line towards the completely corner to make the liner, make the eye look more open. Okay, open. Beautiful. I'm gonna add a little bit more transition over here and extend the lash line, and that eye will be done. So I'm gonna add a little bit of shade. That's why it's always important to see with eye open. You will always be able to see where you need to add. And extend a little bit towards the nose, but I'm literally finishing even before the first lash. Only because your eyes are droopy and we don't want to make the eye look heavy. Okay, so we're doing the second eye, same scenario, working block by block, creating a gradient, and only once we see the gradient, we're moving to our next block. This eye, as you can see, a little bit more sensitive compared to the other one. Like this one has no redness, no swelling. That could happen for a few reasons why. There could be just individual situation. Also, she might be sleeping more on that side, and blood vessels would be more constricted and prone to trauma. Either way, I know my pressure. I know this is not that I'm working with trauma, and the redness will go away. But obviously pay attention that with that redness there is no excessive swelling. That maybe in that case could be the needle is wrong, or your pressure is a little bit too much. Maybe you need to play with the speed of the machine or switch the needle, like I said before. Making sure that that part when the tail go into the lash line, it's all filled up with color, so it will not look like the tail is actually hanging in the air. Again, I'm gonna now ask the client to open the eye, just to make sure where we at. Okay, I'm completed my shading. Once again, I'm not doing a lot of shading, we're doing kind of just smudge liner. Now I'm gonna complete my lash line and blend a little bit lash line into the main color. I'm using tiny needle, 0.2 diameter, and working the tip of the needle, going back and forward, up and down. You can do little tiny circles. As long as you don't put pressure and you're working the tip of the needle, it's very important while completing lash line. And don't forget to not just create a solid line, we're going back and forward and blending into the main color. I'm gonna wipe now. At this point, eyes are very sensitive. We just always have to keep that in mind and wipe super gently. Move lashes a little bit to clean up, potentially dry out color. Okay, I'm gonna fill up a little bit more over here and blend more here, and we are pretty much done. Okay, so work is done. The left eye gave me a little bit of redness, so it swelled up a tiny bit more. And but as you can see, when the technique is right and you choose the proper needle, proper speed and technique, overall your client shouldn't be swollen or have a lot of redness after procedure. I hope you enjoy it, and please, if you have any questions, you can message to my Instagram.